This video will cover methemoglobin, which is an abnormal hemoglobin that can lead to red blood cell disease. To anchor us to the subject, let's first take a look at that suspicious blue glass-like substance, just like from a certain famous TV show, with a red spherical ball next to it. These together will help us remember that this video is going to explore methemoglobin. That dumbbell looks really worn out. It's even rusted. This represents iron within hemoglobin in its oxidized ferric form, or Fe3+, rather than the normal ferrous Fe2+ form. When this happens, hemoglobin becomes methemoglobin. That duck looks a little unwell, and the fact that it's holding a taser is scaring me a bit. This represents the hereditary form of this disease, in which the individual has defective methemoglobin reductase. Doesn't reductase sound just like duck and taser? Moving on to the toy car. This represents autosomal recessive inheritance of hereditary methemoglobinemia. Is that a beehive in a jail cell? It represents cytochrome B5R deficiency, which is a downstream effect of defective methemoglobin reductase. That jail cell looks rather shiny compared to the other cell, doesn't it? You know what else is shiny? Chrome. Since the word chrome is in cytochrome and B5 sounds like beehive, we'll use that to remember this fact. Why is that red spherical ball labeled M? Well, it's because there's an abnormal form of hemoglobin called hemoglobin M that can prevent proper functioning of the enzyme methemoglobin reductase. See that baby holding a blue glow stick? It represents the fact that cyanosis typically appears in these patients around 6 months of age. The color blue represents cyanosis, and doesn't the word stick sound like 6? Looks like there's some unpleasant odor going on here. This represents sulfa drugs, which can cause acquired methemoglobinemia. Sulfur smells bad, doesn't it? The mosquito represents malaria. Quinone drugs, which are commonly used to treat malaria, are also implicated in acquired methemoglobinemia. And since malaria is transmitted by mosquitoes, it'll help us remember this fact. I hope our duck isn't planning on drinking that nail polish remover. The nail polish remover is made of acetone, and it represents phenacetin, another drug that can cause acquired methemoglobinemia. I don't know if the baby should be eating that bacon. Someone come get their baby. Anyways, bacon and other processed meats use additives such as nitrite for preservation, and which also give the meats a characteristic pink color. This represents nitrite drugs, which can also cause acquired methemoglobinemia. Take a look at that banner. It represents the fact that cyanosis results when methemoglobin reaches 10% of total hemoglobin levels, or a concentration of 1.5 grams per deciliter within blood. I hope that river is made of chocolate. It represents the characteristic color of blood in these patients, a chocolate brown color. Reaching the end here, this has been exhausting. Let's get this rooster, or you could call him a cock, over with. It has a ruler right next to it. The cock and the ruler should remind us that co-oximeters are capable of measuring methemoglobin directly. Methemoglobin is undetectable by pulse oximetry and arterial blood gas analysis. Doesn't the coax in co-oximetry remind you of cock? And the ruler, of course, measures, so it should remind us of meter from co-oximetry or co-oximeter. Lastly, the treatment for methemoglobinemia. See how there's a little red cross, the universal symbol for hospitals and just medical treatment, and it's right next to that blue glass-like substance? This should remind us that methylene blue is the treatment of choice for methemoglobinemia.